Artificial intelligence is having a bit of a moment. Will it be a force for good or a force for ill, though? Well, we're now going to the real Helen Carroll, who has spent the day finding out how AI might help reduce waiting times. Definitely a force for good. Helen.
Well, I'm here in Galway and we're looking at a brand new pilot programme that started just this week where artificial intelligence has been used to improve patient experience. I'm joined by Caitriona Lynch. Caitriona, a bariatric nurse specialist. There's only 2 obesity clinics in the country. You're only one nurse in one of the clinics, so you're very busy.
Yeah, it's very busy here. We see 60 patients a week. 25 of those patients are new patients. So as you can imagine, a lot of patients need to be educated between both clinics.
So you're teaching them how to take the medication, and this is where the healthcare avatar comes in.
Correct. So often clinics are so busy you may not get that full 20 minutes to educate patients, and using the avatar as a tool to teach them is fantastic because it means they get the time and then they can come to me and ask questions should they want the nurse experience as well.
Well, they get you in the double because the avatar is modelled on you.
I know, she's the image of me. And if only she had my personality now. Doesn't have that.
I'm also joined by Sean McKibben. Sean is a client in the clinic. Sean, you were educated about the medication in the traditional way and with this avatar. For you, what were the advantages of the avatar?
Advantages is it spoke back to me. I could ask questions. I went through it, gave me a full picture of how to use the medication, was engaging, and really gave me a full understanding of what to do and how to use this.
And you could use it at home, ask questions whenever you had. Disadvantages?
Disadvantages is just that personal sort of having somebody there to understand sort of things I fully understood, and maybe the body language piece. But again, you have that as well. But with the avatar in itself, it gave that full feel of the medication, how to use that.
I'm also joined by Professor Derek O'Keeffe, consultant physician and clinical lead for endocrinology. Why the healthcare avatar, Derek?
So if you look at the healthcare horizon, we don't have enough healthcare workers to provide adequate patient care. Indeed, the WHO estimates there'll be an 18 million healthcare worker shortfall by 2030. So we need new ideas and new ways of helping patients in the future.
And that's where Hollywood stepped in.
Yeah, so the Hive Lab here at the University of Galway, we reached out to the company that did the special effects for Lord of the Rings with this proposal to develop this avatar that you've seen.
Why not YouTube?
So we do provide patients with pamphlets and YouTube videos, but they're very static, very one-way information. The paradigm shift with the avatar is that it's two-way, it's interactive, and it provides reinforcement learning to people's education journey.
You can ask the avatar questions, and the potential for this is really vast.
Yeah, it's a game changer for medicine because you can scan a medicine and it'll give you bespoke education about that medicine tailored for you.
The important thing as well, Caitriona, is to say that this is not to replace healthcare professionals.
Absolutely, it's amazing. It's to complement the service and not to compete with it.
Okay, well, for the 3 nights of Hospital Life this week, we have brought you world firsts from Irish hospitals, which is something to be proud of. So back to you in Dublin.